Hi, this is what would happen if plastic surgeons ran a code.
We need to... wake up! I think I'm having a code. I need a doctor.
What's happening, nurse?
She's not responding, and I'm not sure why.
Well, let's get her moved inside because we don't want sun damage and skin cancer or wrinkles. Plus, it's a little hot.
That's a good idea.
Okay, let's move her.
Make sure before starting a code you have all your appropriate equipment. First, a large bag with all your necessities. Also, you must have lipstick on and appropriate jewelry. I also recommend high heels, which will give you the extra height needed during the CPR. If you're a male, you should unbutton your shirt or just take it off.
After establishing that the patient needs CPR, it is important to get the AED device. For proper placement of the AED device, gently remove the patient's clothing. Oh my God, her implant's ruptured. But we'll get to that. We'll get to that. So, for proper placement of the AED pad, first you place your measuring tape from the sternal notch down to the right nipple. Then you bisect it down the middle. Then you take your point to the left nipple. And then from the left nipple, you go across to the right shoulder. And that line that intersects all of those points is exactly where you need to put your AED pads. Simple. For the other one, you just simply go on the mid-axillary line on the left. Now, for proper placement of your hands for doing chest compressions, again, get your marking pen and your measuring tape, and you go ahead and you measure from the sternal notch to each nipple. Okay, and then from the sternal notch to each nipple. And then from a line from the sternal notch down to the center, the point where all of those bisect is the proper placement of your hands, shown here. Perfect.
Next, it's important to give your victim 2 breaths and then start with chest compressions.
This is where your heels come in handy. You need to have proper leverage above your patient. So place yourself next to your patient and bend over so you have the proper leverage of your arms to give the correct compressions. Like this. As you know, as a plastic surgery resident, it's important to always include your faculty in whatever's going on with your patient, especially if it's CPR. For example, Dr. Bauer.
Hey guys, what's going on? What's going on?
We found her unresponsive, Dr. Bauer. We're doing CPR.
So what's going on?
You know, we found her unresponsive. We're doing CPR.
What do you think? What are you thinking? What you thinking?
I don't know, but her implant's ruptured.
Oh, well, let's just make it make sense.
Okay.
Make sense.
Okay. Thanks, Dr. Bauer. Any other advice?
What size implants do you think ruptured?
Oh, goodness. We'll talk later. I'll let you know.
All right, thanks. Bye, guys.
Bye, guys. And this is what would happen if Dr. Montilla was involved with a code.
What are you doing?
What?
What are you doing?
I'm sorry, Dr. Montilla. I can't hear you.
I need my littlers.
Did you just say you needed your litlers?
I need my littlers.
What do you? I'm confused. Your patient collapsed. I don't know what's going on with her.
When did this happen?
What?
What happened?
I'm sorry. I can't hear you.
Where are my littlers?
I don't know, Dr. Montilla. Well, do you have any ideas of what we can do for your patient?
Looks like you're doing everything I would do.
Okay. Well, thank you. Can you help me with this contracted arm here? It keeps poking me in the belly.
Yeah. Where are my littlers?
I don't know.
I need my littlers.
Where
are my littlers?
Where's Shannon?
My littlers.
Shannon around? Okay. All right.
Where are my littlers?
We'll get you your litlers, Dr. Montilla. Okay. And of course, you always have to notify Dr. Phillips. Dr. Phillips, Your patient about 30 minutes ago, she collapsed on the floor. She went into cardiac arrest, and we've been doing CPR. We've placed the AED pads. We've done everything we could. We did all the correct markings on the chest. I don't know. What are your thoughts on this? Do you have any ideas?
Oh, crap. I'm sorry, that was really unprofessional.
Okay.
Let me see your markings. Can you just step back for a second? I can't see. I can't see.
But I need to. Okay. All right. Okay. Whatever you need, Dr. Phillips.
I think that mark is off over there. I would probably move it a little bit to the left.
Right here.
Yeah, and then do your CPR right there.
Right here.
Yeah.
Is that right?
Yeah. No. Let me show you.
Okay.
Let me show you. Just like this.
Oh.
Like this.
Okay. Like this.
No. Move back. Like this. Okay.
Right
Go
here.
ahead. Give it a shot. Good
Okay.
job, guys.
Oh.
Nice work.
Okay. Thank you.
Nice work.
Okay.
Very
Thank you,
good.
Dr. Phillips. Thank you. Okay. Now that you've fully resuscitated your patient, it's important that you transfer her to general surgery.
Yes, and once she's in the care of general surgery, make sure they consult you so that you can be sure to give her a business card so that she can follow up to get those implants fixed.
It's also important that you recognize that you've done a good job. You have just burned 600 calories, and it's time to go out to happy hour and splurge. You can have a whole carrot. Congratulations. Good job, plastic surgeons. We will be seeing you next time.